Hi, Steve from Wandsworth Physiotherapy and Osteopathy. So we're now providing steroid injections as well at Wandsworth Physiotherapy alongside hyaluronic acid and PRP injections, and all of our injections are ultrasound guided. So research shows that when you use ultrasound guidance, the injectate, the solution you're injecting, is much more likely to end up in the desired target area. So steroids are a class of hormone. They're produced naturally in your body. So things like testosterone, estrogen are steroids, steroid hormones. And there's another class of hormones called your glucocorticoids, and cortisol being one of the main ones. And they have very important immunosuppressive, anti-inflammatory properties to them. Now, scientists developed synthetic steroid hormones, and these can be used as medicine in tablet form, or they can be used as an injection, as a steroid injection. Now, about 500,000 steroid injections are delivered in the UK each year, and the vast majority are safe, effective, and help people with their problems. However, there are some cautions, and there would be some reasons why we wouldn't deliver a steroid injection. So if you don't consent to an injection, obviously you wouldn't receive one. But if you have an allergy to steroid or to some of the other things that are combined with the steroid, such as a local anesthetic, then you wouldn't receive a steroid injection, and you wouldn't inject into an area of active infection. And there also needs to be some caution if you're taking any blood thinning medication. You'd need to speak to your GP, or perhaps even pause the dose of that medication before you have an injection, so that you don't increase the bleeding into the structure that you're having injected. And you also need to be cautious if you're diabetic, particularly if it's poorly controlled, because the steroid hormone can raise your blood sugar for a couple of weeks. Now, there are some side effects. They're very, very rare. Infection being the sort of the main one that we need to look out for, and that's the case with all injections. With steroid injections, you can get what's called a steroid flare, where there's an increase in your pain for a few days before it then settles down. You can also get what's termed fat atrophy and skin depigmentation around the injection site. Now, that's usually only happens if the injection is delivered quite superficially in a superficial tendon, and that just means that the layer of fat under the skin can become a little bit thinned, and you can get some discoloration of the skin around the injection site. Again, it's very rare. And you can also have some other minor side effects, such as facial flushing, mood changes, etc. So they're very, very safe, they're very useful, and they get used for anything that's termed an itis, so an inflammatory condition such as arthritis of your knee, your hip, or your shoulder. Tenosynovitis, which is an inflammation in a tendon sheath. Paratendonitis, which is inflammation of the paratendon, again, the sheath around the tendon, or for a structure called a bursa, or bursitis. So much like in your shoulder or in your hip, when you have a bursitis in those structures. So if you've got an inflammatory condition of one of these areas, or you've just got some pain in a shoulder, an Achilles, a knee, and you're looking for some help with this problem, and you're considering steroid injection, or you've been told that you need to have a steroid injection, and you're on a waiting list, then please do give us a call on 0203 322 9455, and we can discuss some options with you.